Hi everyone, Dr. Suneel Dhand. Welcome to another video. Now we're at a point 3 years into the pandemic where the virus has swept over the globe multiple times. But we still have those same people who are creeping out of the woodwork as the depths of winter approaches, demanding that we return to a mandatory face covering policy. Typically, as always with these people in the United States, targeting school children. Now I want to share with you a piece from the New England Journal of Medicine. And I've talked about this journal before. It's one of the oldest in the United States, one of the oldest in the world. And only 10 to 15 years ago, it was a highly respected, reputable medical journal. Unfortunately, over the last few years, it has become overtaken by a radical political ideology. It has gone full woke in an unbelievable way when you look at some of the titles of the articles that regularly come out of that once medical journal. So with regards to a universal face covering policy, let me share with you this piece. It was a recent editorial from the New England Journal of Medicine. Universal face covering policies in schools and mitigating the inequitable costs of the pandemic. Nearly 3 years into the pandemic, the United States leads high-income nations in mortality. While they never talk about the other factors like the unequal healthcare system and also the baseline metabolic health crisis, that's something that they never want to talk about. And then they talk about how a universal policy is a distinct intervention, and they talk about the evidence that they've plucked out about why it works. Public schools are an important context in which to understand the ramifications of moving from a universal to an individual policy. And then they talk about a recent study on the subject, which they actually pushed within the last couple of weeks. It was a very weak, flawed study that they were pushing because clearly the people in charge really support a universal face covering policy. They talk about the fundamental logical flaw. It's interesting that they should talk about a fundamental logical flaw. Anyway, they talk about the fundamental logical flaw of an individual policy. They talk about how a pre-pandemic normal is unattainable in the short term. Really, because I think most of the world has gone back to a pre-pandemic normal, but clearly not the people at the New England Journal of Medicine. The questions for policymakers are these: how high will we allow the societal cost to be, and who will bear the greatest costs? Universal face covering policies distribute a small cost across society rather than shifting the highest burdens of the pandemic onto populations that have already been made vulnerable by structural racism and other inequities. Strategic use of universal policies could include community-level implementation early in surges of new variants and throughout the year in select classrooms to protect higher-risk children and staff. Interesting that they really want to push this in certain communities, typically the poorer minority communities, but not in other communities. And they talk about visionary leadership. So that is an editorial in the New England Journal of Medicine. And I can't emphasize enough how far off course that particular medical journal has gone. It is now completely politicized. I used to be a subscriber to the New England Journal of Medicine, but I cancelled my subscription long ago. I'm not going to waste my money on a medical journal that is really a political journal. The woke Journal of Medicine, the New England Journal of Medicine. What the heck happened to them? It's also obvious when you read some of their articles over the last couple of years. They have been huge proponents of mandatory face coverings, but they are doubling down now, and they are so focused on children. But I'm sure if it was up to them, there would be mandatory face coverings still everywhere you go, including maybe outside. Who knows? But focusing on this particular article then, I want to give you my 3 thoughts. Firstly, again, it highlights how political ideology has crept into medicine somewhere where it absolutely should not be, when they keep using terms like inequity, structural racism over and over again in pushing health policies. Secondly, this weird obsession that exists in the United States with face coverings, especially for children. I find this obsession weird and, to be honest, a little bit creepy as well. As a doctor who throughout the pandemic has traveled back and forth to the United Kingdom, this is not such a big thing in the UK. Face coverings were a thing in the UK for a very short period of time, but they were never really a thing in schools. I think they may have had temporary mandates, but they were very sporadic, and they certainly didn't have face coverings on the youngest children, on toddlers. But it seems that sections of the US medical establishment are absolutely obsessed with this issue, way out of line with other countries, even way out of line with the World Health Organization, for what that's worth. They are completely and utterly focused on having face coverings in our youngest children. And that defies all evidence, it defies reality. And they're still doubling down on it. And thirdly, it highlights the fact that many of these people, and these are people, remember, many of them in medicine, have become attached to this issue, almost like a religion. They're not concerned with high quality evidence. They push very low quality, flawed studies. But when it comes to randomized control trials, listen to this. Actually, in the editorial, they said they don't want a randomized control trial because it would be unethical. Can you believe that? What a load of nonsense. You could easily do a randomized control trial, but I think these people know that they wouldn't get the results they want. These are people in medicine and healthcare, and they are ready again to pounce. With the winter arriving, they want mandates everywhere. And what I don't get is, why do they want to force their healthcare decisions on others? I have zero problems if anyone who publishes these types of articles, or anyone who wants to do it, wears a mask or even wears 10 masks. They can even wear an astronaut suit if they want. I don't mind. I have a problem when these people want to force their healthcare decisions onto others, onto adults and children. I don't get why they keep wanting to do that, whether it's a face covering or a medical therapeutic. That doesn't follow medical ethics, especially when something is very questionable. If you want to do it, but don't force other people to do it. But I'm not done yet with the New England Journal of Medicine. Let's come back to them for a moment, because I want to share with you some of their article titles over the last couple of years. Dismantling structural racism in the academic residency clinic. Reliever triggered inhaled glucocorticoid in Black and Latinx adults with asthma. I actually know a lot of people of Latino descent, South American descent, and they really they hate the term Latinx. Transgender health and science denialism. Science denialism, that's a good one. Injustice disorder. Racial biology and medical misconceptions. Combating structural inequities, diversity, equity, and inclusion in clinical and translational research. Climate change in the Supreme Court. Wait, I thought this was a medical journal. Decarbonizing the US health sector, a call to action. Protecting pregnant people and babies from the health effects of climate change. Pregnant people, hey? The climate crisis and clinical practice. Repealing state drug paraphernalia laws, the need for federal leadership. Environmental racism and climate change, missed diagnoses. So let's be clear, we do have crises on multiple different fronts in the United States. Millions and millions of people cannot afford basic healthcare. Drug costs are through the roof. Millions of people cannot find a local primary care doctor. We have a doctor shortage. Hospitals are stretched to the absolute limit. We have a metabolic health crisis driving a lot of what we see. Obesity rates are through the roof. Millions of people are addicted to ultra-processed foods and sugars, and there is zero public health push in this area, as rates of chronic lifestyle-related diseases like type 2 diabetes, heart disease, etc. also go through the roof. While all this is happening, our top medical educational institutions and medical journals refuse to touch on the real root causes of what we see, and they're focused on these superficial political issues. And I will not stand idly by as a physician who really believes in the true art of medicine, in focusing on the right things in health and well-being. I will not sit idly by while these extremists and these woke people take over this once noble profession. And I don't think anyone who really believes in healthcare and medicine as it should be should allow this to happen. You can absolutely have an awareness of these social determinants of medicine. That is very important. But we have gone too far the other way, and what's happened to the New England Journal of Medicine represents what has happened in many different sectors of society. We have been overtaken by complete extremists, and we cannot allow it to happen because these people are totally focused on other things, other agendas that are not going to solve the real problems that we need to solve. Medicine should be free of politics. We cannot allow these radical political ideologues to take over this profession. Thanks everyone for listening. Dr. Suneel Dhand. Do let me know your thoughts down below. Hit the subscribe button for more similar videos in the future. Also hit the bell button so you get notified when I make more videos. Remember these things, modern mainstream culture will make you very sick very fast. Sadly, segments of the medical establishment and certainly Big Pharma benefit from a population which is obese and chronically unwell. Two of the best things you can do for yourself are to cut out ultra-processed foods and sugars. Sadly, a lot of healthcare and medicine has become very corrupt indeed, and fewer things are to be more cherished than our freedom. Also come follow me on my uncensored platform. That link is down below, locals.com, where we have more interesting, open discussions away from this environment of big tech, censorship, and silencing, where we talk about things related to the pandemic, related to health and well-being, and all of the current corruption in medicine and science. It's a real shame that I would even need to talk about an uncensored platform in the United States. It's an absolute disgrace, but that is where we are. Thanks everyone again, and we will talk again very soon.